co-transport, if you see the co-transport, this co-transport principle is used for the treatment of diarrhea due to gastroenteritis or in cholera. So whenever there is diarrhea or gastroenteritis, this co-transportation principle, by using this principle only, we will treat the patients. So what we will do, we give, in case of diarrhea or severe gastroenteritis, we give ORS, right? Oral rehydration therapy. We give ORS to the patients. So this ORS, what it contains sodium and glucose. So when you give sodium and glucose, the sodium and glucose together are transported into the intestinal cells and there to the circulation. So this helps to recover the patients and to normalize the intestinal cells. So this is about the transportation or absorption of carbohydrates. Then coming to the disorders associated with this carbohydrate digestion and absorption. So malabsorption of carbohydrates is the primary disorder which you should know. So this malabsorption can be because of two reasons. It can be primary or it can be secondary. So primary malabsorption is because of the enzyme deficiency. The enzymes that are associated with the digestion of carbohydrates are deficient, then this can lead to the malabsorption, and mutation in the transport proteins also can lead to the malabsorption, which can be studied under primary malabsorption. Okay, secondary malabsorption of carbohydrates is because of some intestinal disease. After the some intestinal disease, this secondary malabsorption can be followed, or maybe it can be followed because of pancreatic disease. So this is because of the acquired disease. This is because of the acquired disease, and because of the disease there is poor absorption of the carbohydrates. So this is called secondary malabsorption. So in another disease which can be studied in this carbohydrate digestion and absorption is lactose intolerance, which is associated with the lactose metabolism. So lactose, you know that it is a milk sugar. When if the enzyme called lactase is deficient, then the lactose cannot be digested during the process of digestion. So lactose gets accumulated in the small intestine, and in the small intestine the intestinal mucosal enzymes, cell-bound intestinal mucosal enzymes are there. These enzymes, that lactase is deficient, so it cannot act on lactose. So lactose cannot be digested to galactose and glucose, so it gets accumulated, and when it ventures into the large intestine, the intestinal bacteria acts on this lactose and converts them into carbon metabolites like carbon dioxide and hydrogen. So this hydrogen can be measured in the breath because of the deficiency of the lactase enzyme. So the gas production will be more because this lactose is acted by the intestinal bacteria. So because of this, they feel, those who are having this lactose intolerance, they feel bloating, diarrhea and dehydration. Bloating, diarrhea and dehydration. So again, lactose intolerance can be primary and secondary. Primary lactose intolerance is because of the enzyme lactase deficiency only. This can be seen in infants. And secondary lactose intolerance is followed because of some diffuse intestinal damage. It can be because of infection, or it can be because of colitis, ulcerative colitis, or it can be because of some celiac diseases. So lactose intolerance, what will happen? There is no proper digestion of lactose, and it is acted by the intestinal bacteria, which produces hydrogen gas and carbon dioxide, which causes bloating and diarrhea, and hydrogen can be observed in their breath. So test to diagnose this lactose intolerance: in case of neonates, measurement of stool pH. If the stool pH is less than 5, it indicates the presence of reducing sugar, and reducing sugar test also, if we do this 3+ is observed in case of lactose intolerance in the feces of neonates. Then in case of adults, we can do the hydrogen breath test, disaccharide tolerance test is also there, and biopsy also can help. So treatment for lactose intolerance is lactose free diet only is recommended, and for neonates soya milk is suggested instead of cow milk or mother's milk. Then for adults, lactase enzyme tablets are available which can be taken before going for